My dear friends, we're facing a dystopian fantasy made flesh. We've all argued in the past, we've quarreled, but those quarrels are now over, I think, because now we're all united by something. It's a common bond, and it's humanity itself. We've all been in a technological trance in the past. We've been distracted by mass myths. We've been divided by tribalism. But finally, we all stand together. It's a strange irony because we're separated by space. We're separated by walls, windows, doors, computer screens, but we are united in our hearts. We really are. And why are we here together, even on this call today? I think we're all looking for answers. I certainly am. And we find great comfort in sharing this connection we have as human beings. I think we're looking for answers to unlock this crisis, this political, economic, social, even cultural paralysis that we're all experiencing. And from my work in my life, I think often the answers lie in just a few simple words: empathy, service, compassion, duty, courage. So, in times of this confusion, I think we mustn't lose our capacity to dare to be human and authentic with each other. So, I photographed myself. I'm a portrait photographer and a storyteller, and I am known to photograph the most powerful and successful and celebrated people in the world. But really, my heart lies in photographing people who have been robbed of power, emerging leaders in the human rights community. And they're the ones that really teach me about great leadership. So I know when I'm in the presence of a great person. And today I'm very humbled to be in the presence of a great person, because the person I'm going to have a conversation with today is a doctor. And the doctors, the medical professionals today, the healthcare workers are the true heroes of our time. And it's so sad that it took this crisis for us to really acknowledge that. Um, my guest today, his name is Dr. Ryan Mcgarry. He's an emergency medicine physician, and he works in the emergency room in LA County Hospital. He's also a filmmaker and a storyteller, a very powerful storyteller, and he's recently made an extraordinary series on Netflix called Pandemic. I believe there's this sort of strange, tragic irony that the film was released just a few months before coronavirus pandemic exploded. So Dr. Ryan has been, and all his great colleagues have been telling us about these warnings for a long time, and we didn't listen. So we are listening now. Unfortunately, in many cases, it's very late. But Dr. Ryan, I want to welcome you with great humility. I'm very inspired by the work you do. You are in the front line of this battle. You're in the trenches, and I know you're not a superhero. You're an ordinary person that does extraordinary things. And I know from all my heroes in the human rights community that they're all normal people too. And just because they do brave things doesn't mean they're not frightened themselves. It's just that their idea of service overrides their fears. So I hope to have a good conversation with you today, Dr. Ryan, and just I ask you to just share your feelings, some of your experiences and your knowledge with me, and hopefully it will inspire us all today, because we're all looking for answers about resilience to get through this. So welcome, Dr. Ryan.
Thank you, Platon, and thanks to all of you for joining us today. I feel really honored to be on this call with you all, or conference rather, and I feel certainly in good hands with you, sir. So thank you.
Well, let's just begin with the front line. We're all watching the news round the clock. and we're seeing the images of people, medical professionals wearing masks and protective gear and rushing around, and this sense from our news anchors of impending doom almost. You're in the front line, you're in the emergency room. We were just talking about it just a few seconds ago. Can you tell me what it feels like to be in the emergency room right now as the surge is, I think, is about to explode?
Sure. I want to be clear that there's a strange familiarity about it. Okay, if you want to experience doom in any emergency room in the United States, just stop by any Friday, even any Wednesday night. It doesn't matter often the day of the week. It's important to understand the baseline that emergency departments and the intensive care units that we admit to are almost always full. Almost always, when I have a very sick patient, my next call, once I stabilize them, is to the ICU doctor who says, I may not have a bed available for maybe 12 hours or more than that. Almost always in every emergency department in this country, the nurse who I work with, he or she is wildly overtaxed. It's an inappropriate patient to provider ratio. So, on one hand, what's happening right now is very familiar to all of us, but there's a sickening difference, and that is on many nights, we are tasked with sort of sorting out what is an emergency and what isn't. We like that job, I think. I certainly do. People come in, they're scared. Sometimes they're just drunk. Sometimes they really are having a heart attack. The sickening difference now is that every case is a actual emergency. And that's something that is terrifying. I don't think any of us have seen that in our career. To give you a sense of the physicality of this is a disease that seems to rapidly attack one's lungs in a way that is unprecedented. Even influenza, if one is unlucky, you may have a few days before you really start to get worse. And yes, you still might need a breathing tube and an ICU, et cetera, but there's warning. This disease gives us very little warning. We have patients who arrive speaking to us, and within 3 or 4 hours, they are breathing to a level that would approximate a treadmill in the gym you used to go to. Can you imagine putting a treadmill up at its highest incline? What is that, level 8, 9? And then cranking up the speed as fast as it can go, and then rolling, run. Well, you know what would happen. You're going to breathe 40, 50 times a minute, and the reality is your body will get exhausted. It can't breathe that fast for that long. That's when we need to put in a breathing tube. And so that's happening on the order of hours in our emergency department. And so I think that that's what's very different than anything we've ever seen before.
When 9/11 happened, I was down there, and I was down there as one of the towers came down, and I saw this sort of shock to the system and to everything around us. But the moment where I got really panicked, and it's a strange moment, it's not what you'd expect, is when I saw a police officer, and he was just standing in the middle of this chaos, unable to function. Now, in New York, where I live, we're used to seeing cops and medical professionals and firemen sort of running the show. They're always the authority. They're always the ones that know what to do. And then suddenly I saw the authority rendered almost temporarily in this paralysis that I said at the beginning of this conversation. And it was devastating to see this brave cop not knowing this was out of his control. And I'm wondering how you're personally feeling. I mean, we talk about the medical profession being overwhelmed and the data, but we very rarely get a chance to speak personally with someone who's in it. And how are you coping on a personal level? I mean, are you okay? I don't often see news anchors ask the doctors and the nurses how they're personally doing, because there's very little time to do that. But you're giving it everything to this. Are you okay?
I don't know. I don't know yet. I mean, I think there's still happily some adrenaline. I don't think that's going to last forever. Uh, I'm not someone who dreams a lot for whatever reason. When I sleep, I really pass out. Lately, I've been having a lot of dreams of being sick, of waking up with a breathing tube in me. Um, I can tell you that yesterday I was face to face with a very sick patient who we knew had COVID, and it's spewing out of them. As they're breathing faster and faster. You can't see it, but suddenly, even despite the protective personal gear I have on, the PPE, that I am now in the presence of death and risk. Um, that PPE does not feel bulletproof. There is a sense of one wrong mistake and I'm exposing myself. And now I've got friends and colleagues in emergency departments and hospitals around the country who are on respirators, ventilators, or breathing tubes themselves. So there is a sense right now of frank terror, and to be surrounded by an invisible force that is effectively death, not feel fully protected from it, despite the best PPE we may have, is obviously unsettling, and I'm not sure if I'm okay.
How are your friends and colleagues dealing with it? How you mentioned that you are engaged. You have a fiance. Congratulations. How does she cope with it? How does your family cope with it? How Tell me about people around you.
Well, we had a discussion. My fiance, she's about my age, and we are just the two of us. We kind of had to have a real discussion at one point about how are we going to handle this. Some of my colleagues who have children said goodbye to their families some weeks ago, and they don't know when they're coming back because, of course, every time we go to work, our exposure clock starts over. It's not like it's a firm 14 days for us. Um, we've had discussions about things I don't think most engaged couples talk about, where the important folders are, where all the bank accounts are, what happens if the worst case happens. And I think, at least for us, that has actually made us closer. I think this has accelerated the love we have for each other. I would imagine that a quarantine under this stress is going to either show that your relationship is going to work or not. I think for us, it's been something that's really been healing in ways that I didn't expect, despite how terrified we are.
You know, the way I learn about life is not from books or reading articles in the press. I meet people, I talk to them, and we share ideas the way you and I are sharing ideas. And this is my way of finding out how the world is being shaped. And we know that leading up to this outbreak, there's been something growing in society. It's this breakdown of communication between people, of a value system that's communal. Everyone has become more as an individually empowered, but as a community, we seem to have moved away from each other. And there was this little girl I photographed called Naomi Wadler, and she was 11 years old, and she's a student activist, and she fights for the rights of young African American girls who are all often at the in the shadows of society. They don't get the same opportunities as other people do. So I invited her and her mum to my studio, and I asked her about this paralysis, and she said some amazing things. And I wrote them down. I've got them on a bit of paper. I always keep it here, and I'd like to read it to you. She said, "Talk with people, don't talk at them." This is her, by the way. You're looking at a picture of her. She's beautiful. So she says, yes, talk with people, don't talk at them. Listen to them, don't just hear them. When I asked her about women's rights in particular and women's empowerment, she said, stand with us, not in front of us. So, Dr. Ryan, if I can come back to you, there's a lot of people on this call, and they all registered today for a reason, and they're not here to be entertained or to be. They're here for a deep longing to belong to something again.
Mhm.
And if you could talk to the people right now, what do you say to the ordinary people, particularly in America, who are so frightened? You know stuff that we don't know. You see life in a way that we don't see it. What do you say to the people?
Well, for one, thank you. I mean, I have to tell you, we used to joke, this might sound superficial, but among us in med school, when you're in your late 20s, you know, television tells you that being a doctor means you be sought after, you'll get laid, and you might even get rich. And as it happens, all three of those things in modern times are not true. You lose your 20s due to work hours. You're instantly sacked with $250,000 in debt. And at least in the cities I've lived in, New York City and LA, women and men can find way more interesting people than physicians, as it happens, to date and seek after in this age of startups and apps and creators and content. And so one finds themselves at the end of a gauntlet of kind of a very different reality than what may have been promised. Of course, as I've matured, I'm so proud that I get to help people and be in charge of their health and well-being. But one does not expect, when I was driving to the ER yesterday morning in downtown LA, passing the Staples Center, a palace of sport with Bud Light ads up and down the walls of it and other billboards, a huge electronic message board effectively cheering me and nurses on, saying, LA thanks its healthcare providers. So I want to start by saying I know I speak on everyone's behalf on this one. Thank you. It's totally a game changer to have your support. The other thing I would say, I think that it is hopeful, is that by definition, physicians and nurses, at least that I've worked with, again, are used to this, and it's not something that we love. I would hope that when we emerge from this, the healthcare system will finally be elevated to the key public service that it needs to be, the key public resource. It may not, but even if not, you need to know that we're used to doing more with less. And I've not yet met a physician or a nurse who has said, I'm done. You know, I can't do this. We're still going. We're still very much up for this challenge. And one thing that I find poetic about the emergency department is that it may well be the last place in America where there really is no border and there really is no class determination. In other words, on any typical night in an ER, you may well see a banking CEO in a room right next to a homeless patient, in a room right next to a drug addict, in a room right next to a famous musician. And I cannot think of anywhere else in American life where we may see that kind of equality. And yet, in my little microcosm, we see that. And I think in some ways that makes us very well equipped for this crisis.
I mean, it's very interesting. I've been working on a film about poverty in America for the last 2 years, and I focused most of my work in Philadelphia
Mm-hmm.
because it's the birthplace of sort of modern America as we know it, but it's also the biggest gap between the rich and the poor. And ironically, I've been working a lot with healthcare providers there, and they taught me that actually it's the emergency room that is the front line of society's faults and problems.
Mm-hmm.
In the emergency room, and I spent a lot of time there in the last year, and I mean, I bow down to you guys, the things I've seen, and the energy that the doctors and nurses and your teams have to keep going when you're exhausted, to fight emotions so that you can function rationally but not be callous and still be able to be compassionate. I've seen doctors and nurses have to switch on a different set of emotions when they have to go and inform family members that someone has passed away in the room next door. And then they take a deep breath before they go in, they come out, and then they've got to shake it off quickly because there's another 5 patients they've got to serve. And this selfless uh, this, way of life. I mean, it was very transformative for me to experience that. So, I think another question I'd like to ask you is, I've asked you to share your thoughts with us on the call today about as we are the ordinary citizens in America. But you worked on this incredible film, set of films called Pandemic, and you must have researched that for so long to piece that together as a storyteller yourself and as a filmmaker. Now that the leaders are listening, and we hope they're listening, what do you say to the powerful people, the political leaders, the business leaders, the people who hold responsibility? If you could talk to them, knowing what you know, what would you say to them?
Maybe this answer will surprise you and those on the call here. I would start out with some compassion. I recognize there's a lot of political divisions and blame right now. What I can tell you from the work we did on my show was that multiple administrations of multiple colors, so both Republican and Democrat, over many decades, have effectively deprioritized pandemic preparedness. A ubiquitous theme among all of the folks that we spoke with, and some of these people were at the national level, some of them were at the community level, all said, yeah, I just expect my budget to be cut. I just expect it to be cut. That's just, and look, I get, and I think when you work in the public space, look, cure cancer, we've got to, we've got to, fix education. I have compassion to the leaders who have said, among all the priorities we have, I just can't conceptualize something that hasn't happened in 100 years. Yeah. And I don't think that that's been said enough.
So many emergencies that they have to deal with right now in front of them. They don't have always the capacity to deal with a potential threat that hasn't happened in 100 years.
Right. And so I try to look at this compassionately, that even whatever you feel about our current president or others, this is a hard sell for any leader. Hey, we need to divert funds or attention to something that is so distantly in our past, and also seems so, again, we look towards the 1918 pandemic influenza, even though we have data suggest that everything that is happening now would happen. There's a certain comfort that one has in the modern medical system, in borders. Of course, those are all false comforts. And in fact, the modern era may have made this pandemic even more dangerous because of the ability to fly anywhere in a few hours.
Again, I refer to just experiences I've had. We're all living in isolation now, and I'm sure we're all feeling, maybe not you, doctor, but most of us are at home feeling lonely.
Yeah.
We'll have a set of skills and tools that have been temporarily rendered useless, and at least we feel that way, and we all want to apply our skill set to stop the world falling apart, but we're forced to stand on the sidelines in our home in isolation and watch things seem to implode, and we can't seem to deploy our talents at the moment. I once photographed Edward Snowden, and he was hiding in isolation in Russia. He still is, and this is a very different story. But I found him, I tracked him down, and we got to know each other. And I asked him when I was in Russia about loneliness. And he said something very powerful. Um, uh, uh, he said that loneliness can be a terrifying thing, especially when you've been robbed of all the people that you love. But
Mhm.
loneliness can also be an empowering thing because when you're lonely, um, there's nothing but a wall of silence sometimes. And if you really listen to the silence, you can hear the voices of history talking to you. Now, the reason I'm saying to you, Doctor, is because you've studied history. Your set of programs uh, is a there's references to the past, and you just mentioned the pandemic of 1918. So, if you could listen to the voices of history, what do they say to you? What have they said to you when you look back at the past?
There are some sources who feel that the First World War was actually ended early by the flu of 1918. What does that tell us? I think that there's something in the way of maybe a boiling point that you had mentioned at the top of this meeting that we are in now. Rhetoric, divisiveness, authoritarian-like feeling in the world, and all of it with this tyrannical technology that has somewhat isolated us. As artists, you and I, if I can take off my physician hat for a second, you wonder, okay, is this sort of a natural resetting and something that we should do our best to try and embrace and emerge from this as a unified sort of public who recognizes what it is again to connect. It's really fascinating that families are now embracing family dinners again, albeit on a web platform. We are embracing cocktail hours as couples again. We are really learning maybe what was forced upon us generations ago and have forgot the value of now. And yet here we are sort of having to live this in this modern time. Of course, we're days into it. I mean, when you look at 9/11 in the aftermath, we had no clue yet what it would do to all of us as a collective public and individuals. And I think we're still sort of in that rawness right now.
Okay, so if that's very interesting. If that's what if the past had a voice, that's what it's saying to us. Then let's just deal with the madness of the present. And again, for selfish reasons, I'm very lucky to speak to you. I've been addicted to the news for the last 3 weeks, and I'm experiencing a surge of white noise, and I can't tell what is real, what isn't real. I referred to it at the beginning of this interview with you as mass myths, but they're just everywhere.
Yeah.
So, I'd like to ask you a few technical questions because you are an expert, and I very rarely get to speak to an expert, and I hope that I ask the right questions for our listeners. Um, the first thing is masks, right? The very present. You mentioned it even yourself about protective clothing. Um, we have seen in Asia, everyone wears a mask.
Mhm.
We've been told in America and in Europe that we should not wear masks because they don't really protect us. We should only wear a mask if we are infected. And yet we see that you, as medical professionals, are struggling because you don't have masks and you need them. Um, and yet now the narrative is that if we go shopping to a supermarket, we should wear a mask. Can you just fill us in on the truth? Because people are strong and they just like to know the facts. But having not being spoken to in a truthful way is devastating to everyone who's listening today, and we can handle the truth. So tell us what you feel about the masks.
Clusterfuck. Seriously. I mean a genuine modern scientific cluster. Um, I understand everyone's confusion. I cannot, among my colleagues. We're all at different hospitals. At every one of our hospitals, there's a different policy. Where I work, we've been told to wear at minimum, a surgical mask the whole time. And when we're doing a procedure, something more. How could that be true at one major hospital and not be true at another? What a mess, guys. Yeah. And look, I think there was some logic early on that when we suspected that COVID-19 was not in the community yet, and obviously we don't know when that changed, um, a mask might have been, I agree, ineffective and even potentially harmful. But now that it is in the community, I think it's a very reasonable suggestion that if you have access to a mask, yes, I think it would be helpful. The problem is what if you get exposed and your mask is exposed? I think if you rub your mask and you rub your eye, you see the problem. I don't think there's a simple answer here, and I think that this is where even our nation's top epidemiologists and folks who study this for a living are still scratching their heads on national television, not exactly sure what to tell us.
It's such a relief to hear someone be honest,
Yeah.
And it's actually a relief, and I'm sure it's a relief to everyone who's listening. Just to hear that this is in progress and we're figuring this out, and there is not a simple answer for anything. Tell me what you know about treatments, vaccines, trials.
So, as a general rule, okay, viruses are very tough to treat. This is why we don't have a cure for the common cold. It's why HIV has eluded us for so long. For complicated reasons, let's just make that an assumption. The vaccines, however, are more promising. And one thing that is encouraging about this particular virus is that it is very stable. Viruses mutate, they change all the time. Influenza famously changes every season. This is why we don't have a universal flu vaccine. What that means, it would attack all kinds of flu that we get every year. This virus appears to mutate very slowly, if at all. It's not a moving target. And so out there in the virology community, there seems to be some early progress. But of course, scalability is an issue, right? So even if we had the answer today, I can tell you from my show that in the best of worlds, assuming it was safe, and remember, it has to be safe too, you're still looking at a year plus before that would be available in most Americans' hands, and that is under the rosiest circumstances.
So you think we're probably dealing with this in this way as best we can, at least for another year before we start to distribute any potential vaccine?
For sure, and I think what's very scary is unless we perfectly contain this, what does this look like next fall when coronavirus is still out there, and there's a new wave of spread either by travel or seasons or otherwise? It's so inconceivably huge what this is going to do to us that I sometimes have to step back myself and go, is this completely a new chapter in humanity?
Do you see another wave in fall? We're struggling so much dealing with the present moment, and the thought of a second wave just as we try to start to rebuild society again and the economy as well, that we're hit with a second wave. That's what we hear?
For sure, and we're seeing that obviously in China right now. Of course, just when you want transparency, and we cover this in my show as well, the Chinese are not always reliable to be sharing data, and in past pandemics with SARS and other diseases, they've full on either shut down communication altogether or produced false data. And so that should be, I think, terrifying for those at the very top right now making leadership decisions as to what, even if we get through the spring, what is ahead in the summer and fall. Again, it's just stunning when you walk around your neighborhood. You see these businesses closed and all elements of culture on pause. It's truly arresting.
Tell me about immunity and reinfection. If I've had it, is it likely I'll get it again?
I think there's still questions being answered on that topic, but from what I understand, most likely with a first time exposure, you're good. I do think that there's emerging data to be studied there, and we'll know those answers eventually. But I got to tell you, there was a group of my friends who at one point kind of looked at each other and said, we'd rather get it now.
Yeah.
And part of that, and this was a few weeks ago, was like at least we knew there'd be a bed to have us and a ventilator to hook us up to. Um, uh, what a dark thought.
Yeah. I mean, it's a strange thing, and I don't know if this is just anxiety, but in December, I got very ill, and it went into pneumonia type symptoms, and a lot of my friends had this thing, and it's all the same symptoms that everyone's describing now, and it started in mid December, and
Right.
a lot of my friends had it up until going through January, and yet it didn't really break here officially. Could it be that is that something different, and it definitely wasn't that at that early stage, or could it have even been brewing here without us even knowing about it up to a month before?
No, I think you're onto something. The LA Times here reported just yesterday that there was a cohort of patients tracked by our public health department in December and early January that had flu-like illness that did not rule in for flu, that made a bunch of folks scratch their head before we kind of knew what we were seeing. And I think in the end, Zaire, we may realize that this virus was with us um,
Before.
more, yeah, before we knew. But can I just say something about viruses that's a little spooky to me? And I think we tried to get this across in the film, but I'm not sure if we achieved it. If you go back to your first biology class, like even in, I don't know, like high school, you remember like the discussion of what's alive and what isn't? Okay,
Yeah.
like a cell's alive and like, this piece of rock isn't. There's still experts who aren't sure how to classify a virus. On its own, it's not alive. Okay, if you just meet a virus on a piece of metal, it can't. It has no function. Okay. The moment though it gets onto us, it's suddenly alive and hijacks our own being. It's a strange, almost kind of cancer that invades and takes over. Uh, and I asked this biologist once on our show. I said, well, what's the point of viruses? And he said something I'll never forget. He said, well, I think the question is, what's the point of us? Viruses have existed on this planet millions and billions of years before humans did. And in some ways, we're the invaders to their world. And I just thought that was fascinating that in some ways, viruses are one of the first pseudo life forms on this planet and are, it's sort of the opposite way of looking at it.
You know, um, Something is changing in our society right now. Obviously, there's the health crisis, there's the economy, businesses are folding. We've got this massive, severe sort of isolation and separation, and it's making us all think, as you beautifully said, about what is humanity, and it sounds a bit of a cliche, but it's really not. What do we really care about? And those moments when we think of just a quiet moment when you are able to touch someone's hand who you love, or you're able to just feel just something that we took for granted, to sit in the presence of someone in a room and just watch TV together. These things have been taken away from us. And, you know, I'll refer to another moment in my life. Years ago, I photographed the Little Rock Nine,
Mm-hmm.
and I invited them to come back together in front of their high school where they changed America. And they were all elderly people. I'm going to show you a picture of it. And here they are standing in front of the high school where they changed America's conscience. And but they were not standing together at that moment when I was setting this up. They were exhausted from the travels. They flew in from around the world. There's one lady in a Zimmer frame. Another person, it was hot that day, and I couldn't get the sense of community from them that I knew existed. So there's a lady in the middle, the shortest lady. She's her name's Elizabeth Eckford. You can see it in this picture. She's in the middle. She was standing with her head awkwardly held high, and I made a terrible mistake because for a moment I stopped thinking about humanity and I was thinking about technicalities. And as I said to her, "Excuse me, my dear, would you mind lowering your head to get in line with everyone else?" And then there was a pause, and she said, "Young man, don't you ever ask me to lower my head." She says, "My chin is up high with pride because of what we did together." And at that moment, they all raised their head to her level and they all held hands. And my accident, my callousness in that moment where I stopped thinking about humanity and was just thinking about tidying up a visual shape, it created a moment of unity because I had scratched a nerve.
Mm-hmm.
And that's what happens in society when we are frightened. We come together, we hold hands, we feel a sense of community. And I caught it on film. And this is the last time they were together as a community because the gentleman on the far left passed away after this picture. So I'm reminded through a simple experience that I had that you're seeing every single day in your job, Dr. Ryan, of this we've been robbed of something, and now we're realizing the value. And I'm sure you're seeing moments in emergency room. I want to ask you two things. Firstly, I want you to think about a moment, and if and I know this is not easy because you have to keep yourself together as a professional. But is there a moment that moved you that you can remember that was important to you? Maybe someone gave you a look or someone said something to you that people don't normally ask you about. They're normally asking about the big picture of society and the data. You talk about a moment that pops into your mind.
Yeah, I think this maybe you had to be there, but we start our shifts now with a big group meeting of all the docs and nurses on. And I want you to visualize for a second a lot of construction noises, and it's not a good construction noise. It's construction noises of tents and temporary morgues. Okay, and all of that hammering and sounds and everything else. Our chairman of our ER department is sort of giving us the daily briefing, and behind him, in this big hallway of one of the biggest ERs in the country, someone's literally tacking an American flag to the wall. And I think that that just, there's something about that where I think we all realized, wow, like, okay, this is really a huge deal. And how did we get here? Why us? Why now? You keep hearing about this war analogy, and of course, I've never fought in a war, but my grandfather did, and I always think about, is this the moment that he and others felt just about going into trenches, right before they went into it? I mean, literally, someone's nailing up the American flag, and we're going like, wow, okay, here we go.
It means something, right? It means togetherness. It means a bond of values. It means an idea that we can all belong to.
Yeah. And I think, for all the unity we felt in that moment, I do think on the other side of this, there will be a new movement in this country of anger, I think, from medical professionals. I think there's been a long simmering of again, this feels too normal to us. And why are we just putting up that American flag now? This is a battle we do every night in this country. And I'm not sure if I have necessarily answers, but I can tell you that from our show, we looked into many of the most proud, respected medical centers in this country. And almost always, what we would find out is that there's 2 or 3 days of saline on hand. There's 2 or 3 days of drugs on hand. That's just normal. And so what that represents to a lot of us is sort of a cost-cutting business analogy that, again, I think is no better than at your local Applebee's. And no shit on Applebee's, you know what I mean? Or what, you get my point, that, restaurants exist to cut margins and be, as profitable as they can be. Should hospitals be like that? I don't think so,
Do you think that there'll be, and it's not for us to peer into the future because we don't know, but do you feel that there will be a change in society? There's definitely going to be an economic change, but in terms of values, the thing that you just referred to of what is really an emergency and what should we really invest in and who should we invest in? Do you think there'll be a seismic shift because of this? Or do we go back to our old bad habits as soon as we're able, including the environment, to be honest? There's lots of things that we've neglected and got wrong.
Mm-hmm. I guess I would answer that with a question, which is, anytime I've ever met someone of influence who ends up having to spend a night or two in the ER, their first conversation with me is always, oh my God, I had no idea. This is so bad. We should do something better. And the rawness of their illness and subsequent recovery, it's something that they are very much impassioned about. But when we think about healing and recovery, right, part of that, by definition, is forgetting. To heal, right, we have to forget.
Yeah.
And my concern is that when people go to their ER, when they go to their medical center, when they think, wow, I'm sick today, and this should be so much better. And 6 months later, when they've healed, appropriately, they've forgotten about how shitty it was and how much they suffered. Unfortunately, I feel like on the other side of that, we lose the chance for that reform because there's other things to fix. Yeah.
Tell me then, we're heading into this next phase. Once this crisis eventually passes, tell me about what leadership means to you. There's a lot of people watching who hopefully they haven't lost any family members, loved ones. Hopefully they are well themselves, but they are definitely facing a crisis in the workplace, in business, in the restructuring of society. All companies are facing just trauma right now. About leadership. So everyone's going to start asking different types of questions. What makes a good leader in the next phase of life for us all?
Well, I'm not sure if there's probably smarter people than me to answer this question, but I can tell you that right now in our organizations, I think the best leaders are taking care of the least seen among us. You have to realize that every time these patients come in, and I mean this dead seriously, we are only as good as our custodial staff. Okay, right? These are the people who are paid the least. These are people who are respected the least, who never dreamed that their, low-paying, low-risk job would be exposing them and their families' lives every day. The only thing I can really say to this issue is that when you zoom out to all levels of society, I mean, imagine right now the people delivering your food, the people still working cashiers at supermarkets where they've put up plexiglass screens here in Los Angeles. You can't help but think that leaders will now be judged on how you treat these folks because they are saving our ass. and I mean it. We are only as good right now in my emergency department as we've got to clean the CT scan every time. We've got to clean the X-ray machine. We've got to clean the room. That is the hard stop. In many ways, I am so thankful for them, and I hope that our leadership takes care of them, because without them, I can't help you.
Tell me about resilience, because you just cannot stop. You've got to keep going. There is no break. How do you do that, and what can we all learn from your experiences about that resilience?
Well, I think at least for me, um, I don't know if you know this. I had cancer when I was 19. I thought I was going to be a filmmaker only in life, and then when I got sick, that really diverted me to a whole nother world of medicine. And from that point on, I decided, well, if I had two lives, I'd be one as an artist and one as a physician. I only have one. I'll do them both. Um, Look, I think resilience is very much fed by helping others. Okay, the most energy I get right now is not from coffee, uh, not from Red Bulls, not from runs. It's really helping others, and I believe in that, and it's worked for me through residency, through a challenging film and television career, and I bet you can relate to that.
It's funny. I've only ever spoken to two doctors on this long, intimate way. There's you, and then there's another doctor called Dr. Mukwege, who is a very well-known guy from the Congo, who dedicated his life to women who are survivors of sexual violence. I've got a picture of him here. And a year and a half ago, he won the Nobel Peace Prize. And I asked him, Doctor, what makes you happy? And he said, my happiness is the happiness of others. Mm-hmm. And when I asked you about resilience, you said pretty much that resilience is driven by compassion, is fueled by empathy, if I understood you correctly.
Yes.
It's caring for others that creates this surge of unstoppable energy and activity. So, look, man, I just think you need to know what you mean to us right now, and hopefully, as you rightly say, not just now, but forevermore. And it's all the people you work with. I bet they all have the same value system as you. You're all in it together. I've been working with people in your field for 2 years on this project about poverty, and I've seen it in action. And before then, I was in the Congo with the doctor in his hospital. So I'm not naive either, and I've seen the front lines, and I've been to the darkest places with people and seen the truest of hearts. So I don't know if we have time to take any questions from our friends, but I'm almost, which is very rare for me, speechless because of the stakes are so high.
Manny, do you want to do the questions then?
It's so authentic that this conversation.
Sure. Yes. Hi, everyone. This is Annie Tholman, part of the WSB sales team. Can you all hear me, Platon?
Yep.
Okay, great. Perfect. Great. Well, thank you both so much. I think this has been a fabulous discussion. We've gotten a lot of questions in. So we'll just go through a couple that we've gotten from the attendees. What would you both say, Platon and Dr. Mcgarry? What would you recommend ways for us to continue to stay connected? I know a lot of us, we've been, FaceTiming with family and friends, and we're trying to do the social distancing. What would be some other ways that we can stay connected with our broader communities?
Doctor, do you want to think about the connection between people?
Sure. I think again, I've been shocked at suddenly, my family's all over the country, and I think very hesitantly, I've joined some of these Zoom happy hours. I think that we all become radio hosts when you join them.
Yeah.
But you know what? Maybe that uncomfortability is something good that we should be embracing. What do you think?
I think the formality and awkwardness of technology, we just have to get through. What's important is that we see each other's faces. I recently connected with my mum on FaceTime. She's a 82-year-old woman living on her own in London. She's terrified and she's had, health problems with her lungs. So she's the most vulnerable people on the list. And she's frightened. And as I FaceTimed with her, one of the loveliest things was not just seeing her face, but seeing her house that I know so well. And she saw mine. And it was this, oh, look, there's the bookshelves. There's the sofa where I sometimes sit at, on holidays when we're all together. I know there's awkwardness with us trying to find new ways of reaching, and we can't physically touch each other anymore. It's a horrible, horrible thing to go through. But we are strong, and we're willing each other to connect, to be together. So it was a magical moment just to see my mum's sofa, where I sometimes used to sit and have a cup of tea and just watch TV with her. So I'd recommend to everyone, just work through it. It's awkward, it's difficult, but we're being robbed of something, and we have to find ways to overcome this, and we will. I think we should, maybe we're running out of time, so I think we should maybe start to wrap it up. But I'd like to talk about this thing of optimism, because it's very easy for us all to lose that magical thing called optimism. And, Doctor, I see it in your eyes. I know you're an optimist, even though you're facing such a wave of anxiety and exhaustion. I'm sure you wouldn't do what you were doing if there wasn't a hope and an optimism that you can deploy your talents and your skills and make something better. So I would say that you are optimism alive and kicking in a person. Um, so I want to thank you so much for being brave with me and being honest with me and daring even not just to tap into your knowledge technically, but to dare to be human and to let go a little bit and share your vulnerabilities, because it's really hard for you too. And you have relationships in your life, as we all do, but we see ourselves in you.
Well, thank you. And I hope to, once all this social distancing is over, I hope we haven't completely ruled out the idea of sharing a pint together someday. It'd be great. And to all the audience with us here, hope to meet you as well. And if you want to keep the conversation going, certainly I'm on Instagram and would love to keep chatting with you all.
Dude, I swear to God, when you're next in New York, you're meeting me in my studio, I'm going to give you the most beautiful portrait you ever had taken of you in your life. I'm going to turn you into an epic icon, and then we're going to go out and get seriously drunk together.
Well, that sounds amazing. And if we can end on a funny note, I have a feeling what's going to happen now is we're entering the third week here of social distancing in LA, is that my hair is starting to go like this. We're all either going to have to shave or do home haircuts. So I hope by then I have a proper haircut. And I wish all of you the best. And please stay healthy out there. This is obviously incredible times for everyone.
I'm going to end, if I may, with a little story. So I had the privilege to work with Professor Stephen Hawking, and he was very ill when I met him. In fact, it turns out that this was his last ever photo shoot, and he passed away a few weeks later. This is one of the pictures I took. He was so ill that his nurses told me that most of his body had essentially shut down, and there was only one muscle that still worked, which was a little muscle underneath his eye, like a nerve. And his scientists built this sensor that you can see in my picture attached to his glasses that picks up movement from that muscle. And with that muscle, he can move a cursor over each letter of the alphabet on his laptop screen and choose a letter, build a word, build a sentence. And that's actually how he communicated to the world with his epic statements. So at the end of the shoot, I said to him, Professor, it's an honor, man, to be in your presence. And I'm going to ask you a huge favor, because I've seen how hard it is to communicate for you. But I want one word from you of wisdom, because one word from you is going to be worth 1,000,000 words from anyone else. His nurse steps forward and she says, don't ask him to do that, because he's exhausted. And honestly, she said, that muscle doesn't really work very well anymore. So we have that there more as a formality now. So I turned away feeling a bit deflated that my opportunity was gone. And then I heard beep, 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 beep. And we looked at his laptop screen and we realized he's typing. We all leaned in to see where the cursor's going to go, and it went to the letter W. The nurse said, W, this is a mistake. It's not one beginning of one of his favorite, most used words. So she says, I think this is a waste of time. And he starts a second letter, beep, 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 to the letter O. Then he starts the third letter, beep, 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 back to the letter W. The nurse is getting really pissed off with me at this point because I'm wearing his energies out. And she says, leave the man alone. This is a waste of time. And I said, hold on a minute. That's not a waste of time. It's not a mistake. He just gave me the word wow. He gave me a word that my kids would probably use about the beauty and optimism of life. And I thought to myself, it's amazing that the man who faces so much physical adversity in his life still looks at the world through the eyes of wonder. So for anyone who's listening today, come on, be optimistic. Dr. Ryan is an optimist, and I'm going to try to be an optimist. I've been surrounded by the most beautiful people in my life who are optimists. And let's do it together. We'll get through this, but we've got to get through it and come through the other side better than we were before. So thank you all for listening. Thank you for being honest. And we hope this was a meaningful conversation for you all. Thank you so much. And Doctor, thank you so much.
Thank you, Platon.